make a start. So we're going to start with the bigger picture. We're going to start with some work that our presenter, Mr. Rolf Lewandijk, and Rolf was the former executive director of the Water Supply and Sanitation Collaborative Council. He also formerly worked for UNICEF, and currently he's done this work on behalf of UNICEF in South Asia. So he's really going to give us a look at how we can leverage financing for WASH in South Asia. What is the current status and where are we going? The second presentation is presenter is Ms. Carol Fernandez she's the Principal Water Resource Specialist at the Asian Development Bank in Manila. She's with the water team there, or the WASH team there, and she's going to talk to us about COVID-19 and the economic impact in Asia of COVID-19 and what has been the Asian Development Bank's WASH response. And the third panelist and speaker in this session is Ella Lazarte. And Ella is the Senior Water and Sanitation Advisor at USAID in Washington, D.C. So she's giving us a very late night of her time. And she's going to look at how USAID financial capacity is required for COVID preparedness and response. So I'm going to not go into too much detail and make a start. Please, speakers, you have 10 minutes each. We'll start with Rolf. Just before the end of I'll give you a 1-minute warning before the end of your time allocated. And over to you, Rolf. Thank you very much for joining us today.
Thank you very much, Therese, and I'm very happy to be part of this. Let me delve straight in, because I'll just go over 10 minutes slightly, I'm afraid. So next slide, please. I want to start with the investments required for achieving the SDGs in South Asia. Guy Hutton and Millie Varghese calculated in 2016 the annual investments required for universal access to basic services in South Asia, and that would amount to $5 billion invested annually over the period 2016-2030. And for universal access to safely managed services, an $18.5 billion investment annually is required. And a billion, that's a 1 with 9 zeros. So for our colleagues and friends in India, that's 100 crore US dollars. So those are huge amounts. For urban areas, they estimated 2.8 billion for basic services in urban areas and 8.6 billion for universal access to safely managed services in urban areas throughout South Asia. Now, how much is actually currently being invested? Unfortunately, we don't know that. We don't have a good sense of how much invested, but we can make some estimates. We know that India, at the height of the Swachh Bharat campaign, was investing between $4 and $5 billion annually into their campaign. And now with the new drinking water mission, it's hoped that they will keep up those levels of investments. So based on that, we can estimate that there's maybe around $7 billion annually invested, between $6 and $7 billion annually invested in WASH in South Asia. But this is a very wild guess, and that still leaves us 60 to 70% short of investments for universal access to safely managed services. Next slide, please. Now, where does this funding come from? And if you see this slide, the funding predominantly comes for 62.6% in this pie from domestic and public funding. And public funding, this is governments investing in WASH as a public good. And this blue pie also includes investments made by households, self-supply, households individually investing in their own services. It's not surprising because WASH is a public good, and governments have prioritized this because they realize the enormous impact that good WASH can have on its population. The second piece of the pie, 29.9%, so 30%, is from ODA, official development aid, so bilateral and multilateral funding. And multilateral funding is from our friends at the multilateral development banks, the Asian Development Bank in South Asia, but also the World Bank and a couple of more banks. Now, surprisingly, there's only 7.5% of the funding comes from commercial investors. So apparently these commercial investors don't think that investing in WASH is giving them much profit. Otherwise, it would be a much larger share. Now, how does this contrast with what we always say, that an investment in WASH, $1 invested in WASH, gives us a return of $3 to $9? Now, that return goes into the public domain, goes into a healthier population, a more productive population, a better economy, less health expenditures. But it doesn't, those returns don't come back to an individual investor investing in a utility company. And, you know, I think many of you will know that there's very few utility companies that run a healthy profit and manage to keep up the very, very good services and reach the poor. So the premise is that the funding that we need to leverage comes predominantly from public funding, from taxes, and from ODA. Next slide, please. And specifically when we look at the poor, this is a graph from water.org, and the poor will never be able to pay back on commercial loans or large commercial investments, let alone pay back with an interest. So the ultra poor, that is the focus of this policy lab, will always continue to rely on charities and subsidies. So these are public investments and grants from ODA, from official development aid. Now, many somewhat better off can tap into microfinancing, but even that would be basically people paying themselves for their own services. Next slide. The OECD Development Action Committee website database on official development aid, based on this slide is based on the data in that database. They give that the ODA invested in South Asia in WASH over the period 2015-2018, so that's 4 years, was around $3 billion over those 4 years. And it gives us a disaggregation about how much has been invested in basic systems and how much has been invested in large systems. Now, I don't want to equate large systems as not serving the poor, but we know that you know, a lot of those big loans and a lot of ODA actually doesn't reach the poor urban areas or the poor rural areas. Same for the basic drinking water and sanitation services. They predominantly probably are rural, but unfortunately we don't have a disaggregation between urban and rural. But I think what this slide tells us is that probably not enough is being invested in basic services that tend to benefit more of the poor than the better off. Next slide, please. If we look at the distribution of ODA across the different countries and the proportion of ODA that went to basic services, then only Nepal and Afghanistan invested most of their official development aid into basic services, whereas all the other countries in South Asia actually used most of it for large systems. Next slide, please. Now, if we look for leveraging additional financing for the poor, we just said, look, it has to come from public and it has to come from official development aids, from grants. The examples I'm going to give later on are based on a couple of premises. So the COVID-19 pandemic has tremendously increased the demand for WASH services, has put pressure on service provision. So there's an opportunity and there's a stark need for more investments. I think it's fair to say that throughout South Asia, there is excess absorption capacity for WASH funding. And what do we mean with that? It means that probably many of the listeners on the webinar today, you will have investment opportunities ready. You know, you have projects, you know where you want to make investments, but you can't find the funding. There's plenty of municipalities having investment plans ready, but can't find the funding. Now, The multilateral development banks, and that's the next point, the multilateral development banks, they have more capital available for WASH than they are currently disbursing. And certainly the COVID-19 response funding that was made available earlier this year, a large part of that could actually be invested in WASH. So we have a situation here where we have a lot of projects seeking funding, and we have large funders seeking projects. Now there's a role for us all there. We can do something. Minister of Finance in the recent SWA call with the Ministry of Finance in South Asia, some of them said we don't receive enough requests for investments in WASH. And they also expressed some concerns, as we don't know if WASH can always deliver on time, because if we don't deliver our loans on time, it might jeopardize getting new loans. And we don't know whether they can do that with the right accuracy, the right accountability, and a proper reporting system. So they think, and certainly investing in poorer areas, Minister of Finance are not always comfortable that the risks are acceptable for them to invest in. So what can we, together with governments and development partners and our friends at the multilateral development banks, what we do to bridge that gap between funding and demand? Next slide, please. So this is a graphical presentation on the available concessional financing for WASH. So these are available total loan amounts that could be dedicated to WASH and what is actually being disbursed. And I'm not saying this is to scale. I don't know what the actual scale is, but for the sake of argument, this is the situation. Next slide. Now, what we can do as development professionals, we can identify investment opportunities. And as the banks say, feed their project pipeline, prepare projects for them to consider, and for ministers of finance to consider funding. I think we have a role here with local governments and with the development communities to identify those investment opportunities and make them, present them in such a way that they could be considered for international financing. Next slide. If we do well in that, and COVID funding, the COVID response funds, of course, are an example here. If we are successful in identifying more opportunities, we can actually increase the overall amount of concessional financing for WASH. If you look at the trends in WASH ODA, have not kept trend with overall growth of ODA. So WASH progressively has lost out over the past 10 years. It's creeping up a little bit in the last couple of years again, but overall, WASH has received less and less share of overall ODA. Next slide, please. And while we're identifying projects, we can identify investment opportunities that actually benefit the poor, and then gradually move more of that ODA to where it is most needed. And that is where the urban poor are, where the rural are, and the marginalized communities. Next slide, please. If we're unpacking the first argument, there's 2 more slides to go. Unpacking the first argument, the concerns of the finance ministers, that there's not enough technical capacity, not enough transparency, good quality, and timely delivery of implementation. That's the current situation. As development community, we can work again with the governments to enhance their technical capacity, to come up with ways to actually serve the urban poor and give the Ministry of Finance and our friends at the development banks the confidence that we can deliver with quality, with good approaches, with good accountability and transparency. So these are areas we can all continue working on. Next slide, please. Now, I understand that many of you will be working in local government. And, you know, if you hear figures of investments of 100 million or 150 million, you know, it very quickly goes over your head. These are huge amounts. So you might be looking at an investment of 20, 25 million over the next 3 to 5 years. Now, one way, because a 25 million investment is not interesting enough for most of the development banks. Typically, a loan would start with 100 million. Because it's a lot of work to put that in place. Now, what, for instance, a state could do if it has a series of municipalities that want to make investments.
Could you try again?
No, Siri, that's not you, sorry.
Rolf, just to give you a time check, please.
Yes, thank you, Therese. I'm wrapping up. So bundling smaller investment opportunities, identifying smaller investment opportunities, bundling those into one project and presenting that project for consideration for funding by any of the multilateral development banks is another practical thing we can actually do to get our smaller projects funded. Next slide, please. And this is the last slide. So summarizing, there's still a shortfall of WASH investments to achieve universal access to basic and also universal access to, of course, safely managed services in South Asia. The funding for the poor is unlikely to come from commercial financiers. It is most likely to come from public investments and official development aid. We know there's excess absorption capacity for WASH funding and there's excess capital available. And as development community, we should see how the two can meet, how we can identify pipeline projects and make sure that once we get funding, that these projects are delivered with good quality, good accountability and transparency. Thank you.
Thank you so much, Rolf, and really great food for thought. I mean, I learned so much from such presentations. I mean, my take home, I guess, for me is that 2/3 of the investments are coming from domestic resources, from government's own resources, and that there's money out there. So there's excess money, but our absorptive capacity really needs to look at what's there, and maybe it's how we're doing it rather than what we're doing. We need to look at to make sure that we do serve the poorest, and maybe it's about really the packaging of what we're doing. So thank you very much for that, greatly appreciated. And there's some questions coming in the question and answers box. If you do get a chance to answer them yourself, that's great, and we can put the bigger questions at the panel. So next I'm going to go over to Carl, and Carl, thank you very much for joining us from Manila. Carl is the Principal Water Resource Specialist at the Asian Development Bank, and she's going to take us through what the COVID-19 economic impact has been in Asia, and how the bank has responded from a WASH perspective. So over to you, Carl, and thanks for joining us.
Thank you very much, Therese, and I am delighted to be here today to participate in this discussion and give you a little brief overview in terms of the COVID-19 economic impacts in Asia and ADB WASH response. Next slide, please. So as you can see in the next slide, we're going to start this presentation by looking at, the global pandemic as it persists and how it has impacted different regions in the world. So we see on the left hand, a graph that we're all quite familiar with by this point, which is the number of new cases, the 7-day moving average of new cases for different regions in the world and different countries in the world. And we see indeed that, as we know, the virus continues to spread globally. However, when we unpack that for Asia itself, as we can see in the graph to the right, we see that actually the region that we're discussing today, South Asia, is actually the epicenter of the spread of the virus in Asia. And so when we really can see the difference here between the subregions in the region, where we see South Asia, for instance, accounting for more than 75,000 of developing Asia's new daily cases. And then the next would be Southeast Asia, Central Asia, East Asia, and the Pacific in terms of magnitude of the contribution. Next slide, please. In the next slide, we can actually see some of the responses that have occurred in the region to the COVID-19 pandemic. So there's been stringent containment measures in Asia that at first, were put in place, and then as we can see with time, they've been progressively being eased. So on the left, you can see that temporal progression of this containment measures for the different subregions in Asia. And we can see here on the right as well the different variation in terms of, intensity of those restrictions in time and within regions as well. So to give you a sense of what the types of measures that these can include workplace and school closures, the travel restrictions, and the types of measures that we have all experienced in the region as we have been trying to deal with the pandemic. Next slide, please. So all these containment measures have resulted in severe impacts, of course. So the outbreaks and the related containment measures, on the one hand, as we can see here on the left, have led to mobility reductions. And we can see this as a trend in all the subregions in Asia Pacific. And then a corresponding associated steep GDP growth decline as a result of this outbreak, of course, and containment measures which have restricted the mobility. Next slide, please. As a result, what we've also seen in the region, unfortunately, is growth slumped in the first half of 2020. So here we see this graph where we are actually comparing different variables, consumption, investment, net exports, and GDP growth in different countries in the region, and we're comparing 2019 with the first half of 2020. And so we can see that growth in 11 major economies in the region, have been, basically lower in the first half of 2020 than it was last year for almost all of the economies. And we have to make an exception for Hong Kong, as we can see from the graphs, because it already was in a not as good of a place in 2019. Investment, for instance, shown by the blue bars, also took a hit in the first half of 2020 compared to 2019, and this can be seen particularly in India and the Philippines. Next slide, please. So this is also showing how the governments in Asia have also stepped in with a wide range crisis response. And the different policy packages in developing Asia that have been implemented range from government support to income and revenue, to credit creation, liquidity support, direct long-term lending, and equity support. And what this graph is showing is actually the distribution of those types of policy packages in the subregions within Asia Pacific. Next slide, please. So again, despite the policy support and despite the appearance that things seem to have bottomed out, we're still in a situation where the regional GDP for the first time in nearly 6 decades will contract this year. And this is what you can see here in the graph on the left. So on the other hand, what you can see here in the graph on the right is that regional growth is forecast to rebound to 6.8% in 2021. So again, this is a rebound of the economy, but of course it is not going to be as good as the pre-COVID trend that this graph can show you here. Next slide, please. Again, this decline that we just saw is actually broad-based and is affecting most economies. So this table here is showing you how the forecasts for the economies of some of the countries in the region is being presented in the Asian Development Outlook Update publication of the Asian Development Bank. And you can see basically, as we're mentioning, the decline is broad-based. And when you look at South Asia in particular, you see indeed those predictions for Bangladesh, India, and Pakistan. So the key messages from the Asian Development Outlook Update 2020 that I was mentioning is, again, as we were saying, that developing Asia will indeed contract this year about minus 0.7%, which is the first contraction in 6 decades. And growth, again, is expected to rebound to 6.8% in 2021. 3/4 of the region's economies are expected to contract this year, so the downturn is broad-based. That depressed demand and low oil prices are offsetting some of the supply disruptions, and this is allowing the region to keep its inflation around 2.9% in 2020 and predicting it to be around 2.3% in 2021. And again, the main risk, obviously, to all these predictions is the prospect of a prolonged COVID-19 pandemic, which could derail the economic recovery. So after such an outlook, it's obviously very important for all of us to realize that we have to, find ways of returning to a better economic situation, to engage in dialogue with our finance ministries, and really make the case for WASH as a policy response that can really contribute to a regenerative economy. And so in that context, on the one hand, we have the argument of the connection of the WASH response to the economic situation, but also we combine that, of course, with WASH and the relationship with COVID-19, which we know it is, an infection prevention control measure. And in the spirit, obviously, of leaving no one behind, that ADB has joined WHO and other world leaders in the pledge to provide access to water, sanitation, and hygiene to everyone in the most inclusive way. We obviously need to realize and remember the importance of the access to hand hygiene and the facilities and the products, the importance of protecting the water resources, the importance of safe water treatment, safe water storage at the home, sanitation treatment and disposal, and medical waste disposal. And as we all know, as we're familiar with South Asia, all these aspects are especially important to the region at hand. At ADB, we have provided an overall response of about 20 billion of COVID-19 response package to the region. And now what we're also doing is providing more medium and long-term responses to the effects of COVID-19 and the opportunity that WASH provides to not only provide the IPC that we were discussing for COVID-19, but also the economic recovery policy approach. In order to do that, we are starting also by understanding how indeed has the COVID-19 pandemic affected the water sector. And these effects are also particularly relevant for South Asia, as we will see when we talk about them. So of course, we know that we have, as it's been mentioned before, still gaps in coverage of water and sanitation access in the region. In Asia Pacific, about 165 million people still lack access to basic drinking water, 370 million to basic sanitation, and 50 million practice open defecation. And so Asia, as we know, Asia's poorest people with the water service access, mainly living in informal settlements, and this is very common in South Asia, they have been highly affected by COVID-19 and have been, as a result, found themselves in this COVID-19 pandemic hotspots. At the same time, the utilities that are supposed to provide the service, having to prioritize these continuous and inclusive services and upscaling the WASH activities, have also realized that this has come at the expense of revenue and billing and operating revenue. So we've seen also demand changes, the large industrial commercial water use declines, and at the same time, domestic use increases, which have affected revenues because of tariff differentials and associated cross subsidies. And again, also this increased domestic demand has also increased the risk of potential leaks in non-revenue water. Some of the other impacts we're also seeing in terms of operation and maintenance and CapEx projects in our water sector being delayed due to the lack of revenue and the quarantine. So, which can as well have possible knock-on effects. Water service provider and irrigation staff have, as we know, needed the access to PPE and have also had to be classified as essential staff so they could report to work, especially during emergencies. We've seen supply chain interruptions for operations, potentially compromising service. And at the same time, we've seen an increased interest from our DMCs in water quality monitoring and the use of wastewater for COVID-19 and contagion detection. So this is something that, as we know, wastewater-based epidemiology is being mainstreamed in the developed world. So these are the kinds of impacts that when we are trying to come and build back better and rebuild our economies, we have to be aware of how the COVID-19 pandemic has affected in the water sector as we provide the responses. So we've taken on board these impacts. We've taken on board the realities of the economic impacts of COVID-19, the potential of WASH as a policy response towards a regenerative economy. And at ADB, we've come up with an upscaling water sanitation, hygiene, and health approach for our new activities moving forward. So this has actually included the creation of a new water and health advisory team. This is a new community of practice, which is really composed of ADB knowledge and operational staff in the water and health sectors, and we're providing guidance to integrate and upscale WASH and health outcomes throughout all our region of Asia Pacific, including South Asia, of course. And we're leading also knowledge management with development partners as well, such as UNICEF and others, so that we can improve our understanding of WASH and health issues, and we can share technological developments, policy developments, evidence-based developments to transition to a new normal. And then here on the right, we can see some of the initiatives for WASH and health, aside from the 20 billion COVID-19 response package that ADB provided, as mentioned before, is we have regional technical assistances that are benefiting several countries in the region to mitigate the impact of COVID-19 through, let's say, community-led interventions, through WASH awareness and WASH delivery as an infection prevention control mechanism as well, with the next regional technical assistance. Through
sorry, Carl, I think we may have a difficulty that we're not on the same slide.
Oh, okay. Sorry.
I just asked Neha to move on the slide.
Yes, please. If we could move a couple more slides. Next one, please. Here. So I was
and we're near the end of your time, just to give you it.
So as I was mentioning on the right-hand side, all the initiatives, in addition to the overall 20 billion package that we are undertaking, which includes South Asian countries, such as, for instance, the regional TA for COVID-19 infection prevention and control, benefiting Bangladesh, Nepal, and Sri Lanka, the India project grant that is mentioned there, that is in preparation for Chennai to be able to address co-occurring disasters such as flooding and COVID-19, the Nepal project grant that is improving hygiene behaviors in Nepal and different municipalities. And the last example is it's another way we're helping a different sub-region, which is the Pacific. Next slide, please. And I just want to finish with the next two slides, which actually present the long-term commitment of ADB to WASH projects in South Asia. And you can see just a description here since 2011 in this slide and the next one, please, of all the projects and all the amounts of the projects that we have been preparing together with our countries in terms of provision of WASH services and actually COVID-19 response, because the last 5 projects that in 2020 that are presented there are actually COVID-19 response projects as an indicator of the roadmap and the trajectory together that we have been working on and we continue to work on in South Asia with WASH as the main element for the response to COVID-19, and not only the economic recovery, but also the infection prevention control and the delivery as well on associated WASH-related health outcomes. Thank you very much.
Thank you so much, Carl. And I'm presuming that those lists, the final lists, are probably available on the ADB website, where people will be able to actually see the ongoing projects. But thank you very much for that great overview. Sorry our slides didn't keep up with you. But I think, the big thing is we're seeing we're going to see an impact of COVID on the economy, a downturn for the first time in 60 years. But one big thing and one important thing is that WASH can also be a solution to that, because investments in WASH can also help with the economic, with the development of the increased impact on the economy. Really, really interesting to see how ADB has absorbed some of the COVID response into their ongoing programs and some of the key examples. So thank you very, very much for that, Carl. And please keep putting your questions into the question and answer box if you do have any for the panelists, and or if you're joining us online, there is an email address in which you can send your questions to if you've joined live. So now we'll go on to the third presentation in session 1, And if we can put up that presentation, Neha, thank you very much. So Ella Lazarte, who's the Senior Water and Sanitation Advisor at USAID at the Center for Water Security, Sanitation and Hygiene in Washington, is going to really talk to us about financing WASH for urban poor communities, but really looking at COVID-19 from the perspective of COVID-19. So over to you, Ella, and thank you very much for joining us at such a difficult hour for you.
Thanks so much, and really thank you for the opportunity to be part of this panel, and thanks for the participants who've been listening in. It's early morning my time, but definitely passionate about the topic, so it's like middle of the day then. So I wanted to focus my presentation, and I'm adjusting it in real time, given Rolf and Coral's presentations previously. So I wanted to talk about three things. And the first one's really talk a little bit about the results of the analysis in several countries that we've done in terms of the financial impacts of COVID on water service providers or utilities. And then secondly, talk a little bit about some of the responses that USAID has been supporting. It's not unique to what USAID has been doing, but also I'm sure a lot of organizations in this webinar have also been supporting those kinds of responses. And thirdly, just provide some initial perspectives that we have on mobilizing public and private finance in a COVID modified world. We all know that things have to change. What does that mean, and what might be opportunities for us? Next slide, please. So COVID-19 and effects on WASH, I think that point has been said before, but really significant gaps in WASH services already existed before the pandemic. And so it's not that hard to imagine what the effects might be right now. It makes it much harder for people to actually access WASH services, and particularly those who are living in poor communities and informal settlements. And then without hand washing facilities and water, that leads to more people getting sick, and then it undermines economic recovery and sustainable development. Next slide, please. And so what are the impacts on actual water service providers? There's actually not too much data out there globally. The World Bank launched their COVID financial assessment tool a few months ago, and we've been working with them closely on trying to roll this out in a few countries, some in the Asia region, not quite South Asia region. So for instance, USAID has been doing, basically carrying out assessments of 26 utilities in Indonesia, the PDAMs in Indonesia, over 10 more in the Philippines, 3 more in Kenya, and some in Zambia. So throughout our portfolio, we've been trying to figure out what exactly are those financial impacts so that we can better determine what the policy and operational response would be. And water service providers are actually experiencing severe financial strain due to decreases in revenue at a time when costs to provide services are increasing. And that's across the board, across the globe. And given there's been government mandates that require costly emergency water provision in some areas, including constructing new tap stands and trucking water that have a lot of cost, and supply chain disruptions that also increase operational costs. Service providers also needed PPE for their staff, and costs are increasing by nearly 20%. And that figure is higher in others. And there's also decreasing revenues. So household bill collection rates, so essentially how utilities get their revenues from getting these collections from the households and businesses, they're dropping as much as 40 to 50%. So in a recent study that we did in Nepal, and that will be forthcoming, I don't have the link with you to share right now. I just heard that it will actually become public soon after discussion with our government counterparts and utilities. So in that study in Nepal of 10 utilities, we saw about a 25 to 50% drop in collection rates among 5 utilities, and 4 of them actually we're not collecting revenues at all. And so that's a huge difference in terms of compared to what was happening pre-pandemic. And on the other side of the world, on a different side of the world in Kenya, there was a 50% drop in revenues. And you can see a similar case in Indonesia, for instance, and also in the Philippines. And those results we should be sharing in early 2021. I can't give the percentage figures, for instance, in some of those, as those are still being discussed with our utility and government counterparts. But it's essentially similar to some of the data here, 40 to 60%, and utilities are seeing revenues drop by as much as 65%. And in the region, it's a bit less. So for instance, in Indonesia, some are just dropping 20, 25%. But if you multiply that by the number of months of lockdown, it's actually quite a significant effect. Next slide, please. And I won't go over the slide too much. I know that the previous presentation already talked about what are the effects. There's been disruptions in water quality, increased costs. There's also delays in planned investments in water services, and progress towards eliminating open defecations likely to slow. And it's not happening everywhere. So in the work that I mentioned before in Nepal, a lot of the utilities, the 10 utilities that we looked at, actually did not delay their investments, and they were still doing at least some maintenance work at the time of the survey. Obviously, if the lockdown, depending on the length of time, that could change. And so at least it wasn't as stark as compared to what we were seeing in Kenya, for instance, where we first looked at the water service providers. And back then we thought that by September, so a couple of months ago, they would run out of money unless they got some liquidity financing, some injection of cash. Next slide, please. So what have been the COVID-19 related responses? And as you'll see on this slide, it's quite general, right? So we have to maintain and extend reliable water supplies, and whether that's working through the larger utilities or working to extend that through partnerships with NGOs, smaller service providers, private water providers. We've been in certain countries where we work, such as in Mozambique. We have been able to provide financial support. So part of maintaining and extending the reliable water supply is being able to provide financial support for service providers. And so how do we do that? I think it was Rolf who mentioned that large systems don't necessarily serve the urban poor. And in some countries, those are actually served by small private water providers or CBOs or community-based organizations. So we're working with those smaller providers in where we can, and provide some operational subsidies for a few months to help them buy chemicals, for instance, and pay for energy bills and such, and really trying to just ensure continuity of services. And then also another response is facilitating access to WASH supply chains and commodities. I think that was mentioned in the previous presentation. And just to not across the board is a problem. So again in the study in Nepal, only 2 of the utilities 3 to 4 months after lockdown were experiencing some kind of issue with the water treatment chemical supply chain. But if you in contrast, if you look at a different part of the world in Kenya, a lot of the water service providers were experiencing that because they were importing a lot of the water treatment chemicals, some coming all the way from South Asia, from China, from India. And so that was creating a huge bottleneck in actually providing quality, safe water in the country. And so part of facilitating access is to engage in a policy dialogue, for instance, which USAID has been doing with not just with government, but with development partners to address those bottlenecks in the supply chain so that we can ensure that these much needed chemicals are available in the market. And that means also engaging with the Ministry of Finance. Some of these are tax issues or import issues, Treasury. And so really trying to involve all those different actors in the response. And then the fourth one is developing resilience and recovery plans to build back better. I mentioned that we were doing the analysis on financial impacts of COVID in utilities, such as in the Philippines and Indonesia, and in the Africa region. We've been also using that data to help them develop resilience and recovery plans to build back better, to respond to shocks in the future. And it's really important that we do that. Otherwise, we fall back into the same trap. And it's really interesting. I just wanted to give you one data on this. And this is from our Kenya work. I know it's not South Asia related, but you can picture this kind of analysis as we try to make a case for WASH as a policy response. Well, the water tankers, tanker trucks, which are usually used to supply urban communities, that kind of policy response actually cost over 50 million in temporary solutions in some of the select areas that we were working in Kenya. And that is actually equivalent to providing permanent water services to almost 500,000 people. And so we got to think about the trade-offs and thinking long-term, how can we develop these recovery plans so that we can factor in these kinds of services? How do we cost that out? And also what happens when there's another pandemic or another crisis? It costs a lot to provide emergency services. So we need to start thinking about how to provide, time check, I see. Next slide, how to provide these services now instead of waiting for the next crisis. And lastly, I just wanted to end with I won't go through all of these different bullets, but what have we been thinking about? At USAID, I've been managing WASHFIN, Water Sanitation Hygiene Finance Project, that tries to mobilize private finance. Are we going to do that in the middle of a pandemic? No, and so we've had to pivot, and it's really what Rolf was saying in the beginning. How do we get public? How do we mobilize domestic resources and grants to actually help ensure continuity of services? And it's not all dire, as some of the data I've said, and it's really important that we provide the liquidity financing for water utilities, small or big. But what's more important is to really introduce reforms. And I want to end with this, because we think about funding is important, we need to get more, but we need to improve water provider performance. Rolf said that there's enough money out there, but it's not, projects are not being prepared. Well, World Bank looked at data of 600 utilities a few years ago, and only 15% of service providers were actually covering their O&M and were seen as financially viable. So we need to think about how to have these kinds of reforms and improve performance so that when another crisis hits, we're actually more resilient. So I'll stop there. Thank you so much. Looking forward to your questions.
Thank you so much, Ella, and I don't know what I'm just after doing to my system now, but I hope you can hear me. Yes, thank you so much for that, Ella. And I'll ask now Ella, Rolf, and Coral. We're going to go into a short question and answer session. So, and I'd like to sort of build on what Ella has been talking about, and I guess that is looking at the water operators, looking at the vendors, looking at the capacities. And I'd like to start, maybe Rolf, because I'd like to pose a question to you, because you sort of said that we really shouldn't expect too much around leveraging commercial financing to reach the poor. Does that mean that you don't see a role for commercial or private investors in WASH to serve the poor?
Thanks, Therese, and thanks, previous speakers, for wonderful presentations. Actually, you know, Therese, on that question, I was particularly focusing on the poorest. But of course, I see an opportunity for commercial investments in WASH, and even for informal areas. I mean, the water ATMs, the water kiosks are fantastic examples of filling a niche, filling a gap in service provision. Maybe moving up from tanker trucks to water kiosks is a more sustainable solution. Privately operated public toilets. There's in India and elsewhere, there's fantastic examples of turnkey business models that could be applied and that provide services to the poor. Of course, if we talk utility investments, I mean, there's equity equity investments being made by utility companies, say from Europe, investing in utility companies in the south, taking a stake in their company, and applying all the expertise that they have gained in Europe and elsewhere to the local situation to get them more profitable. So there absolutely, I think, is a role for the commercial sector. But whether these are really going to serve the poor, that is the focus of this policy lab, and the poorest and those informal areas, I think that remains to be seen, because there's no money to be made directly from the poorest. And that was actually the pitch of my presentation there, that the poorest continue to rely on public and grant funding. Over to you.
Great, thank you very much for that. Maybe I'll bring Ella in on this, you know, in relation to how do we look at the viability, because I think you were mentioning about 60 utilities that the bank did, or it wasn't utilities, I think it was vendors that the bank did the study on. You know, how do we work with vendors, and we'll say small scale service providers really, or local operators, to make it viable for them to work in these areas? Or should we be looking at a social safety network and social scheme to support such provision?
Good questions. So I think before I answer that, I do want to speak to what Rolf was saying in terms of how do you leverage commercial financing to reach the poor? And it's really a lot of the funding for the poorest, and I guess one can say the bottom 20% or the bottom rungs of the ladder. I agree that it will probably come from grants and public resources. There are some cases where we can see some commercial finance, but it's few and far between. And I think what's really important is to think about segmenting the market. And so to get to that, I think in the initial slides, there was mention of 7.1% of the sectors funded by private investments. Well, how can we get that to 10%? It's really hard, because we've been trying at USAID and it's been so difficult to do that. But we have to try. And it doesn't mean that it will have to be for the urban poor communities. What we can do is actually leverage commercial financing where it's more profitable, and then make sure that the grants and public finance is actually earmarked or geared towards the less profitable and the poorest of the communities. And it's really important to do that, even with the COVID response. In Nepal, what we're trying to recommend is that you can't just do a blanket policy of waiving fees for everybody. Let's target the poor and marginalized and the people who can't pay, so that we can make sure that we're actually saving some of the scarce public resources that we have in the sector for those that need it the most. And I think it's really important to do that. How do we make small scale water vendors profitable? A lot of them have been profitable in many ways. It depends. Some of the small pipe schemes that you see in Cambodia, in Mozambique, they are turning a profit. But to reach that 20%, it makes it difficult. And I see a question here in the Q&A. They are, and many are, but if you want them to actually serve the poorest of the poor, it will be difficult. So it will have to be a combination of some subsidies to those that need it most. It's not, we can't expect the vendors and private water providers to serve everybody and still be profitable.
Yeah, great. Thank you for that. Thank you for that, Ella. And there's some really interesting questions coming into the chat, and I see a good few of them are around SMEs and public-private participation and others. So we will ask maybe the panelists also to look at maybe answering some of those in the box. But the very first question in the box from Chirabanji, I'd like to give it to Carl, if you like, rather than, I know it's addressed to Rolf, but it really is looking at, if you like, or wondering what are the key barriers for the MDBs in terms of investment, if you like. We're hearing that, you know, it's probably not money, it's probably more to do with systems and services. So a very simple question, Carl, what's stopping everybody from accessing more financing, if you like, or more investment financing in WASH?
Yes, thank you very much, Therese, and thank you very much for the question, which sounds like a very simple question, but indeed, you know, those are sometimes the not so simple ones to answer. I think, you know, a lot of the difficulties are around, you know, the systems, as you mentioned, yeah, and the importance of the enabling environment for all these investments to actually materialize on the one hand, but also then disperse, as the question was referring to. So, you know, we have to ensure that we have the right policies in place and the right institutions in place, so that then these actual investments can, on the one hand, be, you know, prepared and approved in a viable manner for them to actually be effective, and for them to be implemented and for them to be sustainable. And so these are really the key issues that we really have to think about, alongside just, you know, the financial dimensioning of the needs, and, you know, then the financial structuring of those financial flows towards the sector. Well, that alone is not going to actually deliver on the results that we're hoping for. So we really need to make sure that we are really looking at the whole picture and the necessary enabling factors in terms of institutions, of policy, of data, of evidence, and all the strengthening systems approach that we all know is so key for WASH and the WASH sector. So thank you very much.
Thank you for answering that very simple question very easily for us, Carl. And thank you. I mean, I'm just conscious of time, and I just would like to please request that some of our speakers, if you could answer some of our panelists or some of our questions in the question box. There's a lot of questions in there, but I think in the interest of time, we'll move on to the second panel, if that's okay with everybody. So a very warm thank you to Rolf, to Carl, and to Ella. Thank you so much for taking the time to prepare such thought-provoking and interesting presentations, and for joining us. And we hope you'll be able to stay with us for the remainder of the discussions. And I think there may further questions come up. Meanwhile, Carl and Rolf and Ella will do their best to answer your questions in the question box. So now I'm going to move to session 2, which is basically taking us from the upper levels of investment down to where, if you like, the tire hits the road, and really get into sort of looking at what's happening, where we can really look at the investments at a local level. And our first speaker in the session is Ukarsha Kavadi, and apologies for maybe a bad mispronunciation. She's an urban development professional and has worked very closely with state and local governments in India. She's presently the director at the Regional Centre for Urban and Environmental Studies of the All India Institute of Local Self-Governance in Mumbai. It's a centre established by the Government of India. Prior to taking up her role as the director, she worked as an advisor to the urban, and my screen has just gone by somebody. Apologies for this. Prior to this, she worked at Prior to this, she worked at the as an advisor to the Urban Development Department of the Government of Maharashtra, implementing the WASH Maharashtra mission. Her core experience is in research, policy development, and providing advisory and capacity building support to local governments with a focus on performance improvements. So we're really thrilled, and thank you very much for agreeing to join us today. And I think, you know, really we're going to learn and hear about the lessons learned from local governments in India under COVID and in relation to the financing of WASH. So over to you, and we really look forward to your presentation, Okarsa, and I will come in after 10 minutes. Thank you.
Thank you, Teres. Yeah, so like Teres just said, that we looked at numbers and we looked at global investments and the impact on the economy at the global level or at the larger picture of the financing. But yes, what today I am going to speak about is what we have learned from the local governments in India and how do they respond to this overall emergency, more as immediate solutions, but also more as the long-term solutions or interventions toward WASH as a. Before I jump onto that, let me just brief how we are connected with so many local self-governments. So we are the Institute for Local Self-Governments, working as All India Institute of Local Self-Government. Through our more than 330 centers located in various states of India, we are empaneled for providing various services, and we are associated with more than like 1.5 million stakeholders in the country in this urban governance space. So when we interact with urban local bodies, and when the urban local bodies face this challenge for the first time in the month of March, we realized that they were surrounded with number of questions. But every question, I think they could still find out an answer, but every question was backed up with another question: which funds to be utilized for performing any kind of task under this or to address the particular challenge. So we started working with urban local bodies, and we firstly developed a framework for emergency response in WASH. So what kind of activities or what kind of actions that every urban local body or local governments need to take, and administrative actions, or how to mobilize resources for creating infrastructure. Do they require any capacity building support? Since this was an unforeseen challenge related to public health, there was knowledge gain that was required at the urban local bodies. So how are they facing these challenges? What kind of innovative or technology-oriented solutions that they need? And what kind of stakeholder participation to support all these kind of activities? What kind of collaborations are needed at the local level? And to back this up, to make all this happen, what kind of financing is needed? What are the sources that are available? And based on the responses that the cities, so we were able to reach out to like more than 40 cities, 40 towns who have given like excellent response to this challenge. And every minor action was measured on the scale of swiftness, appropriateness, effectiveness, and replicability of that particular investment linked to the outcome of that particular investment or an action. So the resilient urban sanitation response framework was developed based on that. What we realized through this experience is that there are responses that are immediate, intermediate, or systemic. But what is needed, or when it comes to mobilizing the resources, I would say not essentially funds or financing, but in fact, we learned this from the urban local bodies, that every time it was not really about mobilizing funds, it was about mobilizing resources. The first thing that they have done is optimum utilization of existing systems and setup. For example, all the cities under the Smart City Mission of India, they have well-established command and control centers under the mission, which were converted to COVID war rooms. Not only which helped not only in tracking the cases or in containing, but also managing services for WASH. For example, Bhopal Smart City had adopted this option through which they were able to monitor social distancing in community and public toilets. The second option was convergence of various urban development missions and schemes. In India, there are a number of urban development missions that are being implemented. For example, under the National Urban Livelihood Mission, self-help groups are encouraged to create or to perform activities that help them in income generation. So ULBs put in some funds to encourage them to perform activities in response to COVID. For example, develop preparation of masks or PPE kits. So the same fund or the same mission provision, but was directed towards taking actions which can help address these challenges. Third option was exploring their own funds. The possibility, first of all, of checking whether they can make changes in their budget and if they can prioritize or reprioritize their projects and activities. And they could actually call out, they could extract funds from their existing or own budget. But the key thing that we got to know from the urban local bodies is it was not essentially mobilizing funds, but mobilizing resources through partnerships, collaborations. In fact, some of the local governments told us that they were not in need of any fund or a state or a local fund to say, because there was a lot of local response and the support that was extended by NGOs, corporates, or elected representatives who could actually mobilize funds through the local donors or the private sector, the way they supported in this. So it was excellent to note what kind of responses that cities have given to manage or mobilize resources. Coming particularly to a case of Maharashtra, so it is also essential to look at how the state government is supporting urban local bodies to function effectively and address this challenge at the end of it. So the State Disaster Response Fund, very timely, the central government had allowed states to utilize this fund for COVID response. Eventually, the cities have used this fund. Every local government has a substantial grant with them under the Central Finance Commission grant, also the interest on this grant. What they needed is a permission from from the state government to use this fund for COVID response tasks. And very timely, the state government had issued a government resolution for using this grant for this purpose. In the same GR, they have also announced incentives to sanitation workers. They have been our frontline workers and the warriors that we say. So in addition to their remuneration, they will be getting paid under the 14th FC grants. They have diverted this Swachh Bharat mission grant, the remaining grant, towards construction of more individual toilets beyond the targets that the ULBs have already achieved. I think pandemic has highlighted the importance of having individual toilets as the only solution and not relying more on the community toilets. The last was district planning committees at the district level were encouraged to support local level proposals in response to COVID-19. So coming to the overall strategy, which is a long-term solution, and it's not only during COVID, but more like post-COVID, or since, in fact, when Swachh Bharat mission was launched in India, Maharashtra had adopted a very systematic approach for moving towards complete or a safe sanitation solution covering the entire sanitation value chain. So this is the sanitation value chain when it comes to any typical Indian town. And we realized that except a few cities, there is no provision or there are no facilities for treatment, reuse, or safe conveyance of fecal matter. Even in case of Maharashtra, now today's date, it is like total 77 urban local bodies of 400 odd only have some kind of proposed sewerage network or the STPs. Apart from that, so we are talking about gap of around 320 towns, and how are they going to treat their fecal waste safely? If we look at options like sewerage network and STPs, we realize that they, considering their operational and financial challenges, STPs and sewerage network certainly is not an immediate solution for all these small and medium towns. So Maharashtra had very cautiously adopted an approach of moving towards ODF plus, we call it as, moving towards FSTPs, like fecal/treatment plans. And like I said, so the strategy was for moving towards ODF plus. ODF is essentially open defecation free, and ODF plus plus essentially means moving towards universal access to individual toilets, moving beyond toilets, so covering the entire sanitation value chain, and so fecal sludge and septage management. Here in case of Maharashtra, with scheduled desludging, I'll also come to that. But this was not only the promise or not only the strategy or a dream, it was very well backed up with the framework that the state has created. So first part, I think, is the direct funding. Maharashtra is a unique or the only state in India that had earmarked 50% of its 14 Finance Commission funds, which are allocated to ULB for various purposes. Generally, the grant is untied, but which is, in case of Maharashtra, 50% of funds is allocated to sanitation and solid waste management related activities, especially on the SBM. Once again, the unique state that had announced incentive funds for the urban local bodies for achievement of specific targets that are related to WASH. So if they achieve the target of ODF-ness, then they have to then they receive this award money, which they can utilize for moving towards ODF++, moving towards universal access to IHHL during pandemic or even before pandemic, but especially after the pandemic came into picture. Maharashtra has again taken this on priority for moving towards universal access to individual toilets and shifting focus from community toilets to individual toilets, and then augmenting infrastructure under Amrut, smart cities, missions, etc. for creation of infrastructure more for bigger cities. Second is facilitating processes. So it is reducing financial burdens from the urban local bodies. It is not direct support, but indirect support that saves on time and the funds at the urban local body level. So when it comes to any project implementation, it is always at the ULB level, they have to end up appointing consultants and getting into consultancy, tendering and all that. Just to avoid that process, states supported by shortlisting context-specific technology options, which were vetted by the technical government organization, preparation of FSSM plans and modules, or a prototype that we call it as, for the specific urban local bodies considering their populations and the geographic locations. And third is facilitating processes for mobilizing funds through other sources. So National Safai Karmachari Finance and Development Corporation has a scheme of giving loans for procurement of vehicles and equipments. So ULBs, so the state government is encouraging ULBs for borrowing such loans wherever they are needed. And the third category is competition. So whatever provisions that are made under under various urban development missions, state aspires to achieve the highest targets of that particular mission, which is taken on competition basis. Maharashtra is one of the best performance in urban areas and has been achieving various levels. But yes, so using the framework completely to achieve various targets. And then the newly launched Safai Mitra Suraksha Challenge by the ministry that focuses to replace manhole with machine holes. So 27 towns of Maharashtra of 243 of India are have accepted this challenge. And it is not only the state that is supporting, but ULBs are also responding positively to this entire framework. Firstly, once again, Maharashtra is the unique state wherein ULBs have given their local level subsidy for construction of individual toilets. Number of other financial options they have explored, crowdfunding or CSR for construction of public toilets and school sanitation or school toilets. Sanitation credit, ULBs are actually encouraging SHGs to borrow loans for construction of toilets through microfinance. Not only state that has created this framework, yeah, I'll just take one more minute. So not only the state that has created this framework, but ULBs have efficiently. So this is during last 1 year, during the COVID time, more than 100 FSTPs have got operationalized with support from state. Once again, a unique model of Maharashtra, sustainable model we call it as, that the construction of all the FSTPs has happened through 14 finance grant and the incentive funds that they have received, which we call it as ULB's own funds. And the operation maintenance is also going to be taken care through their own funds, which we think is a sustainable and replicable model, which has like highest potential of replicability. And then it's not like only some templates and the modules are created, but quality assurance of this infrastructure is also taken care by a mechanism that is created by state. And the last point here is that scheduled desludging, which in itself is a financial model. So at present, the septic tanks are cleaned like once in 15-20 years, whereas the norms say that septic tank should be cleaned in once in 3 years. So entire mechanism for cleaning of scheduled cleaning or emptying of septic tanks is built. So this is implemented or is demonstrated in two towns of Maharashtra with help from CWAS, that is CEPT University, Ahmedabad. The sanitation tax is levied in place of, instead of that one-time emptying charges. I think we won't get more time to discuss this particular model, but wherein a private sector is also involved in this scheduled desludging, which is linked to, so this is a performance-based annuity model. A private sector is involved based on a contract which is linked to performance. And there is a mechanism that takes care of timely payment. So to mitigate the risks of the private player that wants to actually come into picture by creating a mechanism of escrow account. So this is a model that is adopted by two cities, Vai and Sinnar. I think we won't get much time to discuss this, but that ensures that cities also get revenue from the sanitation tax that is levied instead of one-time charges, which was negligible. Households are getting high quality services because the services are linked to performance of the contract, and private contractor is also actually ensured their payment through the mechanism that is created at the local level. So such kind of innovative models are there at the local level that exist, are demonstrated, are implemented, and have highest potential of replication. What works in summary, what we think is that focus on immediate but at the same time systemic responses, and what investments we are making, whether they have long-term, are they long-term solutions, sustainable solutions. Solutions have to be very context specific. So some states or some cities really aspire for sewerage network. The question is whether sewerage network is the right solution for them. So we have to come up with the right solution first of all to make investments. Enabling atmosphere. So in case of Maharashtra or many other states of India, I would say Odisha, AP, Uttar Pradesh, where we see that the states have created enabling atmosphere for the cities to function, and cities are actually taking up a lot of projects. And innovative financing options at local level, like we said, crowdfunding or sanitation credit. Effective partnerships with private sector. We actually discussed about whether private sector could be involved and on what terms. It is certainly possible, and if we create a platform, such platforms to mitigate their risks. And collaborations. What we have learned is nothing is possible without the local level collaborations and support from various stakeholders. So that's something that comes from our learning. Thank you.
Thank you very, very much, Karsha. I'm always feeling very bad when I'm the facilitator and timekeeper because there's such rich information, and I'd love if we had lots more time to go into more detail. But thank you so much for sharing that. I mean, I think that the depth of the information is incredible, and I think we'd all love to go into it in more detail, but unfortunately time doesn't allow us. But really, really interesting work. I would encourage people again with questions. We'll have time to go into a little bit more detail on some specific aspects. But thank you very much for a terrific presentation. Now I'll swiftly move on because we are a little bit behind. We're about 5 minutes behind, and introduce the next speaker. So it's my pleasure to introduce Mr. Anand Menon, and he's been with Darashaw and Company Private Limited since 2007. He's currently working as Vice President and leading the PMC initiative of Agra Smart City, which is currently among the top 5 in all India in terms of implementation. He has over 13 years of experience ranging from the smart cities to urban infrastructure and PPP project structuring and infrastructure consultancy. He's been significantly involved in various feasibility studies, city development plans, bid process management, and so many things that I can't include them all. So we're really, really delighted to have you joining us, Anand. Thank you so much for giving us your time today, and we really look forward to hearing your presentation. Neha, have you got a copy of the presentation to upload?
No, I'll be speaking.
Oh, you're giving a verbal presentation. That's correct. Sorry, I forgot. Over to you. Thank you so much.
Yeah. So thank you, Mariji, for the lovely introduction. So what I'll be speaking about is that during the COVID time, what are the initiatives taken by the Agra City and Agra Municipal Corporation, and especially focusing on the WASH sector, what are the unique ways in which we could mobilize various resources?
Hello, Anand. I think we're having a connectivity problem here. Neha, can you open the sound on the second? I see he has 2 connections. Till we see if the other connection is working, please.
Yeah, I've requested him to unmute from that account.
Hello.
Yeah, I think we can. Hi, Anand. We have you on the other.
Yeah, am I audible?
We're getting feedback because you have two connections. So if we can hear you, are you connected twice? Go ahead. I think we have you fine now. Please try again.
Yeah, am I audible now?
Yes, you're fine. Thank you so much.
Yeah. So what I was explaining is that, so what I'll be dealing with is the various innovative ways in which Agra Smart City and Agra Nagar Nigam had taken various initiatives during the COVID pandemic, especially with reference to the with reference to the WASH sector as in. So to tell you a brief background, March 2nd, 2020 was the first day in which we received the first positive cases in Agra. So soon after, what we did was that one of the key things that the city administration and the Agra Smart City as such, what we thought was that how to integrate the various departments and how to bring in the all stakeholders together with the how we can leverage it out and get the maximum outputs out of it. As what we have been always focusing upon is creating more from less. So how with less resources, with less manpower, etc., how we can get the more benefit to the various citizens of Agra. So one of the key infrastructure or the key resource that we had was our integrated command and control center under the Smart City mission, which we had set up in Agra, which involves a lot the GIS mapping of the city. We have water
we appear to have a connectivity problem here. Hello, Anand, can you hear me? Could I suggest that perhaps Mariah or Neha, you can try and follow up directly with Mr. Anand and see if we can get him on a more secure line. And meanwhile, we'll go to our next presentation, if that's okay with everybody.
Yeah, Therese, I think that is fine. Thank you.
Okay, thank you so much. Just in the interest of time, we'll move swiftly to our next presenter, who's also going to be looking at municipality level interventions, and this is our colleague Asia from. Can you put up the presentation, please, if it's okay, Neha? This is our colleague from Pakistan, who's basically going to talk to us today about, have we got it up here? Is it possible, Neha?
Yes, yeah, just give me a moment. There seems to be some issue.
Yeah, okay.
Hello, am I audible now?
Anand, you are audible. We were just going to, if you can just, Mariah will talk to you now separately to see if we can get you a more secure connection.
Yeah.
Okay, we'll come back to you in a moment. We'll go to the next presentation and we'll come back to you if that's okay. Is that okay?
Oh, okay, yeah, fine, whatever is it. But I just want to check whether am I audible or not.
You're audible now. Have you changed, systems?
Yeah.
Okay,
Yeah.
well then maybe we'll just go ahead with you and we'll go. You can continue. Please go ahead. Apologies, Asia. We'll come back to you in a moment.
No.
Please go ahead, Mr. Anand.
Yeah. So the idea what we had thought was that by using the integrated command and control center, how we can integrate all the functions of the city. So the first and how we can actually percolate these benefits to the various citizens of Agra. So one of the things that we did was that we in Agra have a civil defense team. So Agra is one of the cities that have a robust civil defense network, which consists of more than 450 to 500 civil defense volunteers who have been selected with a rigorous process by using the police department and who have the missionary seal and that who have that volunteering skills, etc. So what we thought was that how we can leverage the ICT technologies and rope in the various civil defense personnel also. So we, as a part of Agra Smart City and the Agra Municipal Corporation, we launched the Agra Sarvam Setu app. So the Sarvam Setu means that helping for all, the help for all in the Sanskrit Parle. So what we did was that any person who's in distress or any person who needs a help, he can just log on to this app. He can just download this app and click on the SOS button, and any civil defense volunteer in the 200 to 250 meter radius around him, they will get an alert and they will come into the rescue, or they will come to help this person. And what we had focused here special was the drinking water needs, the sanitation initiatives. For example, if any civil related complaints are there, any water supply related complaints are there, because that was a time for the lockdown in which the other functions or the facilities were not functioning. So as a matter of fact, to see the outcomes or how the citizens actually responded to that, we received almost more than 5,645 complaints or the citizens' request we had received using this app, and we have been able to reach out to the citizens using the civil defense framework. So that is basically a classic example of how the citizens group can be used for the benefit of the citizens only. And what we did was that in terms of the health and in terms of the sanitation, etc. and all, we had our smart health centers also working, which we had. Agra is one of the first cities in India to come up with the concept of smart health centers on a PPP basis. So here what we do was that in order to basically tap the urban poor or the economically weaker sections of the society, using these smart health centers, we are actually providing more than 186 diagnostic tests to the citizens of Agra at CGHS rate, at the Central Government Health Service rate. So for example, an ECG may cost, I'd say, 35 rupees. Blood test may cost 6 rupees. Even the spectacles that I'm wearing, it costs just 150 rupees along with the frame glasses and all those things, with free computerized eye testing. It is equipped with dental cleaning and all those things. So during the COVID pandemic, what we did was that how we can bringing the use of the ICT technologies so that more people sitting in the home can avail the facilities of this. So we started with the e-doctor seva or the telemedicine facility. So, and wherein citizens can log into the portal and they can directly consult with the doctor, and the prescriptions also doctor can give, and it is directly linked to our pharmacy. So whatever medicines are prescribed using home delivery during the lockdown, the medicines were also reached to the citizens' doorstep, through which we could actually distribute sanitizers, we could actually distribute masks at very subsidized rate to the citizens, and more than 10,000 to 12,000 citizens have availed this such kind of a benefit. And at the time when that migrant labor issues were all going on, when the migrant labor started coming in,
Okay, I think this time we're going to have to move on in the interest of time, and we will try and come back to Mr. Anand during the question and answer session. Please, Neha, if you could put up the next presentation. So I'm delighted to introduce Asiya Chowdhury from the UNICEF office in Bangladesh. They have been working on targeted investments for high-risk union councils. We thought this was particularly interesting because, oops, have I been muted? Am I back?
Yeah, we can hear you.
Okay, no, it just told me that I had been muted. So basically, while this is looking predominantly at polio, the idea is that it's very similar and was used to address the COVID response also. So I'll leave it to Asiya to sort of explain and to come in. And then Mr. Anand, I see you're back, but we'll come back to you at the end of this presentation during the question.
I'm sorry, I don't know what is happening with my connection. Because
yeah, it's okay. It's always the time when you want it to work that it doesn't. So we'll come back to you, and please stay with us because we're really enjoying your presentation. So over to you, Asiya, and you have 10 minutes, and I will I'll come in just before the time. Thank you.
Great. Thank you, Therese, so much. Good afternoon, everybody. And just to say, I think Therese had in the earlier part mentioned Pakistan, but she just said Bangladesh. So this is a sort of look at a situation in Pakistan. No worries at all. We thankfully to say that, you know, we're one of the last two with polio, so we don't want to spread it anywhere else. But next slide, please. So what we're looking at is really making the case, as Therese said, for targeted investment in WASH, in particularly in polio high-risk union councils of Pakistan. I think it is common knowledge that we're one of the 2 countries where polio is still endemic, and hence it's a national, but it's certainly a global priority also to eradicate polio overall. What we looked at in a review, or what a review of the polio program in 2018 revealed, was that really the polio program needed to do more. We needed to look at the low level of basic services in these communities where really the polio cases were coming from, and to understand the multiple deprivations in these areas, with the idea that, and the thought that there were 40 union councils identified in 3 blocks. So for those of you who are a little more familiar with the region in Pakistan, the city of Karachi with 8 union councils, the city of Peshawar with 18 union councils, and parts of Balochistan and the city of Quetta, where we had another 14 union councils, where we felt that if we could eradicate polio in these union councils, we could eradicate it from Pakistan. But there was really a review that said we really do need to look at the basic services in regards to water, in regards to sanitation, in regards to health, education, etc., to understand how we could better serve these communities. One, to improve services overall, but also to look at community engagement, reduction of community resistance to the polio vaccine, which there was a lot of, and really understand the systematic bottlenecks in terms of not just health infrastructures, but WASH infrastructures as well. So we defined sort of a integrated program which looked at nutrition, health, water and sanitation. Birth registration is something UNICEF always prioritizes, as well as some elements of education and other areas, to understand how this integrated program can contribute to interrupting the polio virus. But again, particularly within WASH, we were looking at increasing access to safe water and sanitation in these areas. So what we set out to do was to understand specifically the state of WASH in these areas, and many of them were urban informal areas, urban slums, or peri-urban areas with very limited services. There was a lack of trust between community and service providers, not just with water and sanitation, but others as well, and what we could do. So what was this minimum or very basic package that we could look at to support increased access to WASH services, but also to support ultimately eradication of polio in the country. So what we set out to do was to define and develop this minimum package and to cost it into an integrated investment plan. This started all about a year ago, a little over a year ago, following the review, and has really got a little bit of sidetracked due to COVID, but has now come together quite nicely. Next slide, please. This is sort of what we wanted to see in the end. This integrated program, looking at what our health sector colleagues wanted to look at in terms of universal health coverage in these 40 union councils, what we would invest in water and sanitation infrastructure and services in these areas, general health system strengthening, EPI services, etc., nutrition and stunting, and also child protection services. And what would that be investment that would be required for these areas of this minimum package? And it was challenging, I think, to see and for others to understand that impact of WASH, but I really think we came out where now it's quite heartening to see our health sector colleagues talk about that value and that impact of investment in water and sanitation has on health and health outcomes. So this is kind of the output of what we wanted to see in the end. And so how did we get there? Next slide, please. What we set out to do first was define the minimum package, and it was based predominantly on qualitative assessments with some level of quantitative data that we already had with us to define, okay, what is the minimum we need to do in these areas? These 40 UCs, as I mentioned, are sort of divided into 3 blocks, where the situation in one block is quite different than perhaps the water and sanitation situation in the other 2. But UNICEF took as our sort of basic guidance from our global framework for urban WASH to define what would be these levels of intervention at the user level. So where we looked specifically at behavior change and community outreach, the service level, so the improvement in the provision of services, both related to the public and the private sectors. And then what are those things at systems level that we needed to look at, policy and strategy, leveraging funding and financing for these areas. And what we did was against the backdrop of the basic issues related to WASH. So there's only one example that I've presented here related to water quality, but likewise, we did this for water quantity, for sanitation, including open defecation where relevant, but also drainage and sewage and FSM, and also water quantity, solid waste, community engagement, and WASH in institutions, meaning WASH in health facilities and the investments required in WASH in schools. To define for each union council, initially the blocks, but ultimately the union councils, on whether this issue was of a low concern, no concern, a medium concern, or a high concern for the block, and what would be the required interventions as laid out at the user level, the service level, and the system level, and the responsibilities associated with those activities. And then also understand the costing of improvement in those areas, whether they would be low, whether they would be medium, or they would be high. And that way we were able to define an overall minimum package, but that could be tailored to each union council based on the specific needs, and ultimately to lead to what are the costing of the entire package and the UC level packages. Next slide, please. So apologies for the image here. This is sort of though what we've come up with at the end. So the minimum package defined, as I've said, tailored to the individual blocks and the union councils. But a WASH minimum package for the block of Balochistan, for the province of Khyber Pakhtunkhwa, which is the city of Peshawar basically, and for a cost for our Karachi union councils, which is Sindh. And it ultimately came to a cost of about 47 million US dollars. And as you see here, there's costs laid out for health system strengthening, there's costs associated with birth registration, and I guess all the health costs are put in as the same. And what there is a slightly blurred image here of is just an example of one of the union councils, specifically in District Peshawar, and how we laid out what are the related indicators related to health, related to water sanitation, related to birth situation, what are birth registration, what are some of the bottlenecks for each of these areas, and the associated cost for this specific UC, which certainly isn't visible, including WASH, and how is that impact brought out? What do we think would be the reduction in the number of under 5 deaths averted if we were to take the investment case for this union council forward? And so, and next slide, please, actually, to look at the. So what we really found, and I think I mentioned earlier, it was heartening to see that now we had WASH, which we all understand is very important, and we all understand the value and the return on investment we get and what we expect to get, but that we had the polio program, which hasn't in the past focused on this, and we've had our health sector colleagues really come out and say, hey, this is the importance of WASH and polio eradication. And I think we've also seen that now in COVID and infection prevention and control, the important role that WASH is playing in this. We've found that, well, I think we got a little sidetracked with COVID, so we haven't really been able to go out with this investment case to see what is the response to it. But we do hope that we are able to leverage some funding based off of this. What we also saw was that this whole process from the qualitative assessment and the development of the investment case allowed for us to delve into specifically where we could complement or where we could guide the larger development bank investments in WASH. Mentioned specifically here, there's a large World Bank and AIIB program in the city of Karachi, and we were able to say, hey, these are some of the union councils where deprivations are high, and it would be a huge added value to the eradication of polio globally, where your funds can be sort of used in these areas as well. And I think all of them, even in Peshawar, we have an ADB program, or ADB has a program looking at the development of the master plan. And within that, there's phases and there's certain allotments, whether they're grant or loan, I'm not sure, as part of serving underserved areas or improving services in underserved areas. And I think we also looked at now where we're talking about more than just WASH for WASH and really understanding the impact of that. And I think that's had a huge advantage in sort of getting WASH on the table where it isn't always there. Specifically, just because we've been talking about COVID, just to say that, and this is the last slide, Therese, that COVID, what the development of this package pre-COVID did allowed us to really be prepared to scale up and use the investment case at least to a certain degree as we responded to COVID. And I think that there has been, it has allowed us to scale up the response quickly. And I think we continue to see that those high burden districts for COVID are those same as those high burden districts for polio. So we're hoping that the investment case continues to hold through so that we can continue putting investment into these areas as priority, but I think it remains to be seen how that happens. So over the next month or next 6 months to a year, I think we'll be really able to assess whether this has had a value in terms of really leveraging more resources for these deprived areas in terms of water and sanitation and other sectors as well. And I believe that's my last slide. So thank you. Happy to take any questions. Thank you, Therese.
Thank you very much. Thank you, Asia. And I mean, I think a really interesting case where we look at how we can best package WASH and do an investment case to really look. And this is particularly important for our high density, low resource settings where there isn't as much investment. And how do we, if you like, and I think even linking it back to what Rolf was saying earlier, can we pull a number of packages together into one broader proposal? So thank you very much. And we know that it wasn't specifically COVID, but very interesting that you had this ready and it was able to be converted and utilized under COVID, and we got good learning. I'm going to try again to see if we will have success with Mr. Anand, and I'm keeping my fingers crossed and everything in the hope that we can give him another couple of minutes before we go over to question and answers. Anand, are you there? Ooh, it looks as though we're really not having luck. Oh, wait, now. There you go. Good. Please, I know it's been very disrupted for you, so please, 2 or 3 more minutes just so that you can wrap up on what you were telling us.
Continue from what I was saying.
Please. Oh, it looks as though you're having problems again. Okay, you're back, you're moving again.
So another which is under the leadership of the local municipal council. Under this leadership, he selected a lot of citizen volunteers, sanitation initiatives, etc., and all those things. So this to percolate these initiatives during the lockdown period and during the COVID pandemic. What we did was that the various financial institutions that was associated with the Agra city, like where the funding from the various schemes used to get routed, and where we used to have the bank accounts, etc. And for example, whether it be Life Insurance Corporation, whether it be Punjab National Bank, whether it be National Housing Bank, etc. and all. So our municipal commissioner had written a letter to them, and we had called them for a virtual meeting, and each of of those financial institutions by which we could actually provide a lot of safety gear for the sanitation workers, the equipments related for the sanitation in terms of fogging, in terms of PPE kits, in terms of mask, etc. and all. So what we did was that in order to effectively monitor this, again, we had roped in the civil defense team over there. So the civil defense team would actually, when the centralized inventory was kept, and the civil defense team would take care of the distribution among the sanitation workers and all those things like that. Then apart from that, what we did was that whichever private firms that were working with us for the various schemes, whether we had a lot of ICT enabled companies like Bharat Electronics Limited, like Lookman, etc., and all, who are actually working in our command and control center projects. So what we did was that we actually roped in funds from them also, and there were a lot of citizen forums also, by which under the through Agra Smart City and through Agra Municipal Corporation, we actually did the crowdfunding. Typical initiatives by which we could actually loosen the funds for the WASH related initiatives that during the COVID pandemic. And around more than 1,200 to 1,300 sanitation workers were there. So well in time, we were able to give them the protective gears, whether in and also sanitizers in terms of fogging, etc., and all those things. And one another unique initiative, what we did was that we call it the 24-hour golden cycle. So once a positive case was actually identified, what are the various steps that we had to do in the next in terms of identifying the contacts, or whether in terms of fogging response team, we call it the RRT, that was formed, who would actually be performing this 24-hour golden cycle in the appropriate time itself. And there were appropriate third-party quality inspection also that was being done in order to ensure that this 24-hour golden cycle was getting implemented. So these were the, now if you see what are the outcomes of that, from being one of the topmost cities in terms of positive cases in April 27th, now we are almost the 67th or the 17th city in the country in terms of the positivity, and as well as in terms of the active cases also. So if you ask me to summarize, what are the key success factors a city should have? Stakeholders plus the citizens, how the government departments work hand in hand with the citizens, and how we can get more from the less, from the we can
Okay, I think it's such okay. I think it's such a pity your connection isn't so great, but I think we managed to get most of it. So thank you so much, and thank you for sharing it. And I think as you summarize, how can we get more from the resources we have, and how can we better distribute them? So thank you so much for that. I'm going to hand over to my colleague Evariste, who's going to facilitate the questions and answers for the three panelists. Evariste is my counterpart based in Bangkok. Over to you, Evariste.
No, thanks very much, Therese. And I can see a very interesting presentation, and thank also to Utkarsha, Anand, and also Asiya for their very nice presentation. For each of them, I have only one question, because the presentation are totally clear, and also I have some of the questions for the Q&A box. So for you, if you can put your video as well, might be good. Utkarsha, Anand, and also Asiya, if you can put your video so that we can see you responding to the question. For you first, Utkarsha, the question is about leveraging, living sanitation tax, which is very important. And the question is how viable that is, and how it's managed. And then related to this question is it only in the area where you have FECA sludge management in place that you are levying sanitation tax? So this is a question for you. Over to you, Utkarsha.
Yeah, yes, thank you. So yes, I was looking at a couple of questions in the question box as well, which are more around living sanitation tax, which is something, let's say, new for cities in India. In the structure of the tax, like for any ULB, there is a provision for levying sanitation taxes, but mostly cities have not levied such kind of a tax. This is in case of Maharashtra. So there is property tax, and as a part of property tax, there are some solid waste management taxes. So there are some other taxes. However, there is no special sanitation tax, which is a separate tax that the cities can levy. However, it is not levied because such kind of services are not provided from the council or the local government to the citizens. Since the service was provided based on demand generated from the citizens, it was only one-time charge that was collected in the beginning. However, since the time that the service is provided as a scheduled service from the council itself, it is levied as a sanitation tax. So for example, for a city of Y, which is 50,000 odd population, sanitation tax of rupees 60 per annum is charged as against one-time charges that they had to pay for 1,500, like for one-time cleaning, 1,500 odd charges that they had to pay. The second question is whether only the cities that have gone for FSM. So here by FSM, we mean that scheduled desludging. If the cities are practicing scheduled emptying of septic tanks and they are providing this kind of a service to household for cleaning their septic tank once in 3 years, they can levy or they have levied such kind of taxes because they are providing that kind of a service. Otherwise, the cities are going for one-time charges if like linked to the service whenever it is provided to the cities. So I think that answers the question.
Thank you very much. I think it's a very, very clear answer for all of us. So for you, Asiya, very important, we see also the whole costing of the integration, integrated package to stop polio and how the whole cohabitation of, the area where you have a polio case and malnutrition was the clear determinant to have the package. So one question to you is, how the costing takes into account some of the overlap activity that is, for education, for WASH, for health as well. Are those costing excluded, or how do you come up with those kind of iteration? Over to you.
Thank you, Évariste. I think luckily to say that as WASH, we were focused on the WASH portion of the investment case, and being as efficient as WASH usually is, we were able to finalize that in March before the shutdown for COVID. And the other costs have been developed independently, and now we're sort of merging them together to look at an overall cost for the integrated program. Certainly there are some costs that we had costed independently, and we've tried to streamline, for example, community engagement costs that we're not all going independently to do community engagement. So those are something that's been costed across the board as a common cost, but not duplicated within each package. But for example, something like specific improvement in services, in water and sanitation, that is costed separately under the cost work the cost for the WASH investment part of the case. And then those commonalities are across the costs are associated. And I think that's it. I don't know if that answers the question.
Thank you very much. Just a quick follow-up question on this. What is the time frame of the costing, and also related to that is the time frame of the costing, and also do you take into account the existing program and then the program that is coming, those states in the coming 3, 4, 5 years as well?
Sorry, Évariste, I got the first part of the question, but the second one kind of got mumbled. I don't know if it's my connection.
Take into account the existing program in the area, or the program that will be coming in 3 or 4 years as well in the same area?
Yeah, so the initial costing is for the minimum package is costed over 3, and in some cases of the sectors 3 to 5 years. But what we really did was cost the minimum package. So we, for example, for WASH, where we understood in the union councils in Peshawar, we expect the ADB program to be up and running within a couple of years, and in Peshawar the same for the World Bank program. We really weren't looking to duplicate those costs. We were looking at what is the cost required to implement over a period of 3 to 5 years. But it really doesn't, despite the cost looking large, especially to some of our non-WASH colleagues, we don't expect to take care of all of the longer term water and sanitation needs in these cities, which are certainly much larger than what we've proposed here.
Okay, thank you very much, Asia. And the last question is to Anand, and also thank very much, Anand, for the very nice presentation. You talk a lot the e-doctor saver concept, which is very good, and also how you subsidize some of the WASH products to give to the family. So the question to you is, where the subsidy, where the money to subsidize those costs is coming from? The sanitation, product to the household. Where are those, subsidy amount are coming from? Over.
Okay. So what we here did was that in terms of that unique concept of the smart health center that we that I talked about was that. So one of the reason why we are able to subsidize the cost was that because there we have enrolled the private sector and we have developed the entire concept on a PPP mode. So how we are able to subsidize that fact is that he's banking on the volume. So what we, in order to percolate that if benefits of the smart health center into the community, we went and we built camps among all those vulnerable communities, among the, in India we call it Dalit Bastis or the slum population, etc. And also we conducted more than 125 free health camps, and then we identified the population who and all those things like that. So now if you see that if a particular test for a diagnostic test is say costing say 50 rupees 50 rupees outside, so we are actually cutting down the manufacturer to the directly to the citizen, not directly from the what you say, directly from the bulk procurement to the directly to the end consumer. We are directly providing it, so by which we are able to take out the test or before.
Okay.
Cost, etc.
Yeah. So yeah, the connectivity is not good. But I understand the whole explanation, and thank you very much, Anand and Asia, and also Kavadi. I will hand over to Therese and thank Therese for allowing me in to facilitate the Q&A. Therese, over to you.
Thank you so much. Thank you, Evariste. And again, a big thank you to Utkarsha, Anand, and Asia. Really interesting presentation. Anand, we're going to get you a different service provider next time to see if we can get a better connection. But really good. Also, a big thank you to Rolf, to Ella, and to Coral, and to everybody involved. As you know, today is the last day of the four series, and I think most of us have really enjoyed the whole series. We've had, I think, 700 people register, and we're also streaming online. Our colleagues at Center for Policy Research will be developing the outcomes of all of these discussions into a report. They'll also be sharing the presentations online. And I think I'd be remiss, I think we have 4 or 5 strong partners in this, coming together on this, but the heavy lifting has really been done by the Center for Policy Research. And I personally would like to recognize Neha, who has been keeping us all going and together and has been the silent force behind us all. So thank you very much, Neha, and also Pooja. I'm afraid to mention too many names because I'll probably miss somebody really critical. So just a big thank you to everybody, a big thank you to the whole team in the background, and a thank you to all our speakers. And we're 2 minutes over time, so apologies if the timekeeping didn't stay so good, but I think 2 minutes is okay. So thank you very much, and have a pleasant evening, everybody. And I think, we've learned a lot of lessons that maybe there's a good reason for us all to connect in 2021, and hopefully it won't be under the title of COVID. Hopefully it'll be under broader urban development issues. So thank you very much, and over from me.